I'm going to do an NG insertion. The first thing I would do, I would go into the patient's room, identify them with their ID band as per their name, date of birth, and then I would explain the procedure to them as the doctor ordered it. And then to get ready, I would raise the bed up to my height so that I'm not having to reach. And then I would raise the head of the bed to a semi-Fowler's position, or 60 to 90 degrees. And since I'm right by the patient, I'm not going to leave the patient. I'm going to put the side rail down so that I can reach him easier. And then I would wash my hands before I get started. And I'm going to put my gloves on. Pad over him to protect himself. And then I would take a nasal history, see if he's had any trauma to his nose or anything like that. Check for any kind of obstruction in his nose, and check for patency, see which side gets the most air out of, which side would be best to go down. And then once I'm ready to put the NG tube in, I'm going to measure to see how far down it'll go. So I measure from the tip of his nose to the tip of the earlobe and down to the xiphoid process, which there's right about this green mark. So I would take a marker or a piece of tape and mark where it is I would need to go to. And then I would put lube on the end of it. And then tell the patient, I would have a cup ready. Tell the patient that they need to keep swallowing the entire time. And if I hit resistance, and slightly twist the tube, and it'll help it go down a little easier. And then meeting quite a bit of resistance. If the patient had arms, I would have him holding the cup, but our patient doesn't have any arms. Okay, so now I'm at my point where I marked the NG tube, and I have to check to make sure that I inserted it in the right place. So I would draw up 50 milliliters, and this came out a little bit. So I would draw up 50 milliliters of air and attach it to the end of the tube. I'm going to inject the air to make sure that you can hear the air going into the stomach. Okay. And now I'm going to pull back on the plunger just to make sure that we're getting gastric juices out. And there we are. So now we're in the right place. And then you want to put those back in to make sure that you don't deprive him of the enzymes that he needs. Okay. So once you know that it's in the right place, you want to take the skin prep and wipe his nose off to make sure you wipe all the oil and everything off of his nose so that the tapes will stick. And then you take the piece of tape and you want to split it down the middle. Not all the way, because some of it will go on his nose. And then put the tape on his nose. And then you take the tape around this way and around this way. And then you make sure the tape's tight to secure it, to make sure it's not going to move. take your safety pin and pin it to his shirt, leaving a little bit of slack but not too much. And this way, if he moves, it'll give it a little bit of extra slack. And then you'd ask the patient if he needed anything else. I'd put the side rail back up, put the bed down and adjust his head to how he wanted it. And then I would document the nostril that I put it in, how the patient did with the procedure, if whether or not it was being hooked up to suction. And then when I go to insert, to take it out, and then part of while it's in, you want to make sure that you're maintaining a plan of care for the NG tube, making sure that you're doing nose care, so that gunk doesn't get built up around it, and that it doesn't stick to the inside of the nasal cavity, the wall. Okay, so when the doctor thinks that it's time to come out, you'd want to cap it off for a little bit, take it off suction, and kind of cap it for a couple hours to see if the patient gets any nausea with it. If he does, then it's time. It's not time to take the tube out. So I'd come in again, introduce myself to the patient, explain what I was going to do, wash my hands, put my gloves on, and then I would unattach the tube. Gently take the tape off. You don't want any skin breakdown. And that's another thing, while it's in, you want to make sure that you change the tape regularly so you don't get any skin breakdown. And the nose is pretty oily, so you're probably going to have to change it at least once a day. Okay, and then when you're ready to take it out, you instruct the patient that he needs to take a deep breath until you're all the way out. And then you pinch it off to make sure that none of the gastric juices get down into the trachea. And then you pull it out pretty kind of quickly. And then you have the patient blow his nose afterwards to make sure you get all of the excess out. And then you would document that you took it out, that the patient responded well to it, or how the patient responded to it, and then put the patient back how they were. And then you would ask if they needed anything else before you left.